Okay, so we've got to the top of the spine. We're looking at the cervical spine here. These are the vertebrae of the neck. And let's include the head. Let's say that the tops of the spine is C0, which would be your skull. And I really, really like to think about the head as being an extension of the spine, which of course it is. And without this crucial alignment of the skull on top of your spine, so many things fall out of place. We'll do a very detailed look about the head position in another video. But let's look at the individual vertebra of the neck. So C0, the skull, and particularly here the occipital skull, the base of your skull. We were looking at foramens, little holes between the vertebrae where spinal nerves come out. We have a large foramen here, which is where you've got your brain. The skull supports your brain, protects your brain, and then the spinal cord comes down from this foramen, and because of the way the vertebrae lock together, they create the vertebral canal where the spinal cord goes down all the way through, down to the base, cauda equina down here, and all your spinal nerves come out between each of the vertebrae. And this red thing here represents your cranial nerves. These are different to spinal nerves. They come straight from the brain and move down through the cervical spine and come out between the cervical foramen, and they're slightly different from spinal nerves. Below C0, the skull, is C1, and this is also has a very specific name. That is the Atlas. It's a bit like the Greek god Atlas, who holds up the world. You can think of your brain as being the world. And this is the vertebra that supports your skull. The way that these fit together create a massive range of pivotal movement. Perhaps this joint alone has the most movement of all your spinal vertebra. So you've got that round and round movement. What prevents that from actually doing that? There's actually not a lot of things prevent it from doing that. You could just really try to isolate the rest of your neck vertebra, gently clamping your hands around your neck. I'm not throttling myself, and seeing if you can keep the rest of your neck still, and just to let your skull pivot on that top vertebra, and you'll find that there's a huge range of movement going on there. Then below that we have another interesting vertebra, which is your axis. And if you can see very clearly here, if I lift this one up, you've got this kind of little pokey bit here. So there's a hole in between the atlas and the axis, and that can then cause, so these two vertebrae together, if I just gently clamp slightly lower down, you've got pivotal rotational, so you've got just in that top joint between atlas and axis, you've got this amazing range of rotational movement. And actually, if we didn't have all the muscles, we could probably turn our head 360 degrees. So it's the soft tissue of the neck that is what stops you from turning your head all the way around 360 degrees. And that also allows for a lot of lateral flexion, so I'm not moving the lower cervical vertebra, just the top two. and turn the head from side to side. A little bit of extension and flexion, but that actually starts to take place further down through the cervical spine. And then, so let's look at the continuous ranges of movement. The flexion at the front of the spine, a cervical spine, is good. We have the ability to, for some of us, and you just work out in your own body what your range is, but bringing the chin right down to the chest, that would be the what stops you moment, where the chin reaches the chest. And actually, if you could go further, you might be able to, but that is what prevents you from flexing any further. So flexion in the neck, excellent. You have to be very careful when extending your neck for lots of reasons, but these are quite fragile, these little bones in the cervical spine, and you really don't want to fracture these bones by taking your head too far back. Also, we looked briefly at the cranial nerves and the spinal nerves that come out from the foramen here. And what this model doesn't show is that we have lots of blood vessels here. We've got some big blood vessels that go up to the brain that feed the brain with oxygen and nutrients. So when we extend the neck and we start to take the head back, you've got to do that so cautiously. And if you feel numbness, tingling in your hands, your arms, it will mean possibly that you're compressing the blood vessels or the nerves. And so you just go a little bit back. See, there's nothing going on in the hands, arms. Perhaps go through a gentle flexion and slowly go back into extension. But for some people, if there's no feeling of tingliness or numbness in the hands, I'm starting to get it a little bit now, so I wouldn't go further back than that. I might do just briefly to show you that for some, taking the back of your skull all the way onto the back of your shoulders is an available range of movement, providing that you don't have bone-on-bone compression in the processes of the cervical spine, these pointy out bits, and that you don't cut off the blood supply or you don't crush the nerves in the neck. But some people really like that. It feels completely available and completely comfortable for them. I would just be really, really cautious about exploring that range of movement in your own body, and just really check for sensation in the hands and arms, and then you'll realise quite quickly whether that's appropriate for you or not. Lateral flexion takes place much better higher up in the cervical spine. We can bend the cervical spine side to side. It's kind of better range up at the top rather than down here. This can be a dodgy area. This could be, we have, some of us, I definitely have it, Dowager's hump, a kind of fatty, lumpy area at the back here, because the whole of the cervical spine is slid forward, and this bone then pokes out a lot, and this whole range of movement around these joints here is limited. So it would be good to practice trying to rotate. We didn't look at rotation yet, but when you're rotating your neck, we've got good range of rotation up here, but we try to increase, if possible. Sometimes bone and bone on compression will mean that is not possible to rotate that. But if you can try to get a decent range of movement around these vertebrae, protracting the head is really important in all ranges of movement. So we try and bring the head into alignment before we go into a range of movement. So if I was to rotate, let's see if I can get that going down through the cervical spine into the thoracic spine. Feeling of pushing your throat forward and putting your shoulder blades back can help to reduce the lumpiness around that joint if you have Dowager's hump. So we've looked at rotation, flexion, lateral flexion, extension of the neck, and just probably to say, I've not already mentioned it, that's a lordotic curve, and also to say that, you know, in some areas of the spine we've talked about variations in number of vertebrae, but in the neck we all only have 7. There is no variation in 7. So, and I think that is true for all mammals. Anything else that we need to say about the cervical spine? We will go into detail about forward head posture and postural alignment of the head, neck and shoulders in another video, but I will briefly look at the whole spine and the variation of movement throughout the whole spine. We've separated the sections, but actually we don't move separately through the different areas of the spine. It's much, much more healthier to think of your spine as one complete thing, including the head, and this organic range of movement throughout the whole spine, and that kind of trying to get into the freedom of movement, the snakiness of the spine, as a complete organic whole body rather than separate sections. Thank you for watching.